That it'd be coronavirus and then it would hit
Coronavirus.
COVID-19.
COVID-19.
Malaysia. In March, Malaysia was failing. Newspapers published articles about how Malaysia was struggling against COVID-19. Malaysia had 3 times more cases than any country in Southeast Asia. The virus was in every state and federal territory.
6 feet. Don't shake anybody's hands. Just lose that for a while. And wash your hands as often as you can, because you may be inadvertently touching something.
Jumlah kumulatif kes yang telah pulih sepenuhnya daripada jangkitan COVID-19 dan telah discharge pada ward adalah sebanyak...
Saya nak mengingatkan sekali lagi, pandemik COVID-19 masih belum berakhir. Jadi sama-samalah kita beristiqamah dalam mengekalkan kejayaan kita melawan wabak COVID-19.
Assalamualaikum and a very good day to everyone. I am Shahada Binti Jalil with ID 86033002599601 from OUM Learning Center Alosta. I am a second-year Bachelor of Nursing Science with honor. So today I would like to give some information about the importance of hand washing to all of you. Hand washing, which also known as hand hygiene, is the act of cleaning one hand with soap and water to remove bacteria, germs, viruses, dirt and other harmful and unwanted substances that stay in human hands. In the middle 19th century, hand washing was first recognized by Ignaz Semmelweis, a Hungarian physician who works in Vienna. Even though the implementation of hand washing reduced the number of infections, but it was not widely adopted. In the 1980s, foodborne outbreak and healthcare-associated infection led to the United States Center for Disease Control and Prevention to identify hand hygiene as an important way to prevent the spread of infection. Therefore, they are announced the first nationally endorsed hand hygiene guidelines, and many more have followed. The outbreak of swine flu in 2009 and the COVID-19 pandemic in 2020 led to increased awareness in many countries of the importance of washing hands with soap to protect oneself from such infectious disease. WHO has stated that hand washing is one of the important ways to prevent the virus from spreading apart from wearing masks and social distancing. In medical setting, there are 2 different ways in performing the hand hygiene. First is basic hand washing, which will be performed before touching the patient and also used in daily living, and surgical hand washing, which will be performed before any surgical procedure. So, as for today, I would like to state about the basic hand washing for our daily living activities. So, when we need to perform this hand washing, as mentioned by the WHO, there are key times to wash our hand, which is before, during, and after preparing food, before and after eating food, before and after taking care of someone who is sick, before and after treating a wound and a cut, after using a toilet, after blowing your nose, sneeze and cough, after touching an animal, after touching garbage. As addendum, during this pandemic COVID-19, You have to wash your hand when you are in public place or touching a surface or item, for example, shopping cart, door handles, and gas pump. And lastly, wash your hand before touching your face, eyes, nose, and mouth. So, why this hand hygiene is important? First, it will prevent illness to spread onto other people. As we can see, washing hand can help to reduce the chance to spread the infection because people are tend to use their hand a lot in a daily life. People frequently touch their eyes, nose, and mouth without even realizing it, which can make us sick from the germs that are spreading onto the surface. Germs from unwashed hands can get into food and drinks while us preparing or consume them. Germs from unwashing hands can be transferred to other objects like handrails, tabletops, or toys, and then transferred to another person's hand. Removing germs through hand washing therefore help prevent diarrhea and respiratory infection and may even help prevent skin and eye infection. Second, it will help educating communities in stay healthy by teaching them the importance of hand hygiene. The WHO has implemented Safe Life Cleaning Your Hands campaign. So, through this campaign, we can create more awareness to the adult to apply it in daily life while sharing the information with family and friends. Third, by not washing hands will harm children around the world. As we can see, children are a vulnerable group that are easy to get sick. According to the Center for Disease Control and Prevention, CDC website, had mentioned that about 1.8 million children under the age of 5 die each year from diarrhea disease and pneumonia, the top 2 killers of young children around the world. CDC also mentioned that hand washing with soap could protect about 1 out of every 3 young children who get sick with diarrhea and almost 1 out of 5 children with respiratory infection like pneumonia. Children should be exposed to the importance of hand hygiene from early age, which can encourage them for lifelong habits. Hand washing is also good for children development where they learn to stay clean and healthy. There are 2 ways of performing a hand washing. First, by using soap and water. Second, by using hand sanitizer. As we can see in the picture in this slide, which I had retrieved from dailymail.com, shows that there are a lot of difference by not performing a hand hygiene and performing a hand hygiene. As we can see in the first picture, shows that there are white indicates just how many germs go unseen on the surface of our hand if we don't wash our hands. The second picture shows that after washing our hand for 5 seconds, there is still a germ stain on the base of the palm. The third picture shows that the recommended 20-second wash clean the germs of the hand the best. And the last picture shows that after hand sanitizer was applied, there are still far more remaining germs than a 20-second wash. The CDC recommends using hand sanitizer that contain at least 60% of alcohol, as those without alcohol may not kill all the germs and can irritate your skin. Therefore, CDC encourage people to wash your hand the old-fashioned way with soap and water when you can. The WHO has stated the 7 steps of hand washing. First, wet your hand with clean water. Second, apply enough soap to cover all the surface of your hand and wrist. Then, rub your hand palm to palm with the soap thoroughly. Rub back of each hand with palm of other hand with finger interface and then change to another hand. After that, rub palm to palm with finger interface. Rub with back of your finger to opposing palm with finger interlock and change to another hand. Rub each thumb clasp in opposite hand using a rotational movement and change to other thumb. Next, rub tip of finger in opposite palms in a circular motion. Lastly, rub each wrist with opposite hand and change to another hand. Make sure to scrub all the surface of your hand, fingertips, fingernails, and wrist. Rinse your hand and wrist under running water and use your elbow to turn off the tap. Dry your hand with clean towel. Hand washing should take at least 20 seconds, but for more effective and best outcome, we can extend it to 40 to 60 seconds. As a conclusion, hand hygiene is a key component of good hygiene practice in the community when they are in home or public. It shows significant benefit in terms of reducing the percentage of getting infection such as respiratory tract, skin infection, and others. The pandemic COVID-19 that's still active all around the world have built up people awareness toward hand hygiene along with other ways to prevent from infected by the virus. People really take a serious part in following the government guidelines in lower the probability of infection. Hand hygiene is really helping communities to prevent from getting sick and also apply it into daily life, which make them aware of the benefit from it. So, keep your hand clean by performing hand washing. Thank you for today.